Welcome to the Slop Farm. Enjoy the video.
In this video, I will explain how to perform an ear lavage as a medical assistant. First, always begin by clearly explaining the procedure to your patient and obtaining their informed consent. Next, gather all your essential equipment such as an otoscope, an irrigation syringe, and a basin. Ensure the water is at body temperature, around 98.6 degrees Fahrenheit. Finally, position your patient comfortably, typically sitting upright, and perform an initial otoscopic examination to assess the ear canal. Now, let's move on to the lavage process itself. Fill your irrigation syringe with approximately 60 milliliters of body temperature water or a saline solution. Gently pull the patient's auricle upward and backward to help straighten the ear canal, providing a clearer path. Carefully direct the stream of water towards the superior posterior ear canal wall, never directly at the eardrum. This technique helps dislodge the cerumen safely and effectively, allowing it to flow out into the basin. Once the lavage is complete, it is crucial to perform a thorough post-procedure inspection. Use your otoscope to re-examine the ear canal, ensuring all cerumen has been successfully removed. Gently dry the outer ear with a soft cotton ball or tissue to prevent moisture buildup. Provide the patient with clear post-procedure instructions, such as avoiding cotton swabs, and schedule any necessary follow-up appointments. Finally, meticulously document the procedure, noting the amount of cerumen removed and the patient's tolerance. Safety is paramount when performing an ear lavage. Never proceed if you suspect a perforated eardrum or an active ear infection, as this could cause serious complications. Always use water at body temperature, around 98.6 degrees Fahrenheit, to prevent dizziness or vertigo. If the patient experiences any pain, nausea, or dizziness during the procedure, stop immediately. Remember to advise patients against using cotton swabs, as they often push earwax further into the canal.
Thanks for watching. Consider subscribing if we helped you today.